Hello student. Now we are going to discuss another topic in renal physiology, that is renal clearance, right? So if you look at the definition of clearance in books, then it is a little bit difficult to understand. So first of all, you try to understand what is happening in clearance concept, and then I'll go for the definition. So to understand this topic, first of all, I am drawing a schematic diagram, okay? The same schematic diagram I have made already multiple times, okay? So this is the afferent arteriole, glomerular capillary, and then efferent arteriole, okay? And surrounding this is nothing but Bowman's capsule, okay? Fine. So whenever certain amount of plasma is flowing at the level of glomerular capillary, normally that is 700 ml of plasma is flowing here, and in this plasma various substances will be distributed homogeneously, okay? One of such substances is creatinine. All of us know that. So that is the endogenously produced waste product in the body due to muscle metabolism. So we are thinking of creatinine first, okay? That whenever certain volume of plasma is reaching at the level of glomerular capillary, creatinine is also reaching along with plasma, and that creatinine is homogeneously distributed inside this plasma, obviously, okay? So that is a homogeneously distributed inside this plasma. This is creatinine, okay? Endogenous waste product, okay? Now we all know that whenever the plasma is reaching at the level of glomerular capillary, there will be filtration. That is a normal GFR, glomerular filtration rate, okay? So whenever filtration is occurring, I know that within this 700 ml of plasma, 16 to 20% plasma will get filtered at the level of glomerular capillaries, right? So whenever certain volume of plasma, it may be 16%, maybe 20%, whatever, whenever certain volume of plasma is getting filtered, so this volume of plasma is getting filtered, okay? Where from this plasma is coming up? This is coming from the plasma at the level of glomerular capillary. So whenever filtration is occurring, creatinine will also filtrate along with this plasma because it's a freely filtrable substances. So whenever the creatinine is filtered at the level of Bowman's capsule, I can understand that the plasma, okay, which was inside this glomerular capillary, it is getting cleared of the creatinine. The creatinine is getting clear up from this volume of plasma, and this much of creatinine is reaching at which level? This much of creatinine is reaching at the level of Bowman's capsule. That is the meaning of filtration. So certain volume of plasma is getting cleared off at the level of glomerular capillary, right? And that clearing is due to filtration, okay? Now, we also know that creatinine is secreted at the level of proximal tubules, okay? So after this filtration at the level of glomerular capillary, remaining volume of creatinine, okay, obviously there will be some remaining volume because only 16 to 20% plasma is getting filtered here. So the remaining volume of creatinine will reach at the level of efferent arteriole, and from this efferent arteriole, it will reach at the level of peritubular capillary. So this is your peritubular capillary. So it is reaching at the level of peritubular capillary. I told that creatinine is going to be secreted. Where the secretion occurs? The secretion occurs at the level of proximal convoluted tubules, where from the secretion is coming from the peritubular capillary. So the creatinine will be secreted from this peritubular capillary at the level of PCT. So whenever there is secretion, again certain volume of creatinine, certain amount of creatinine is reaching at the level of proximal tubule. So what will happen? Certain volume of plasma is going to be clear from this peritubular capillary loop, obviously, because this amount of creatinine is reaching from peritubular capillary to PCT. So there will be clearing here also, clearing, okay? Certain volume of plasma is getting cleared even at the level of peritubular capillary, right? Now, by definition, if you measure the volume of plasma which is getting cleared of this creatinine, if you are able to measure the volume of plasma, so where from the clearance has happened? The clearance has happened from two locations, from the glomerular capillary as well as from the peritubular capillary. If you measure this total volume of plasma which is getting cleared of creatinine, then that volume of plasma will be known as the clearance of creatinine. Getting my point? So it is the volume of plasma. The volume of plasma which is getting clear of creatinine, which is getting cleared of creatinine. Can you measure this volume? Answer is clinically it is not possible, because you have to do micropuncture. Okay, you have to enter inside the nephron and then you measure what is the volume of filtration, what is the volume of clearance at the level of PCT. But that is not possible clinically, right? So that's why we have to go by certain indirect way to measure what is the volume of the plasma which is getting clear at the level of this glomerular capillary and what is the volume which is getting clear at the level of peritubular capillary. We have to go in an indirect way. What is the indirect way? I am measuring the amount of creatinine from the level of urine. Why you are measuring? Because I know whatever creatinine has reached already at the level of this Bowman's capsule and at the level of this PCT, whatever amount of creatinine has reached in these two locations, this creatinine is not going to be reabsorbed because creatinine reabsorption is not possible from nephron. So all this creatinine will ultimately release at the level of urine, right? So what I'm going to do, at the level of urine, I'm collecting the urine and I'm measuring what is the amount of creatinine. So this creatinine has reached from two locations. One is from the filtration. So one is from this filtration amount of creatinine and one is from the secreted amount of creatinine. But whatever, I have measured what is the total amount of creatinine which is present at the level of urine amount. Okay, what is the unit? Milligram per minute or milligram per hour, whatever. You have measured that what is the total amount of creatinine in your urine, and then you are measuring what is the plasma concentration of creatinine. What is the plasma concentration of creatinine? Which plasma? Arterial blood plasma. Arterial blood plasma. Okay, arterial plasma. So you are measuring what is the plasma concentration of creatinine. Plasma concentration means unit will be milligram per ml or milligram per dl. So now, if I divide the amount of creatinine which is present in urine, right, upon your plasma concentration of creatinine. Plasma concentration of creatinine. Okay, so what I am doing here, I am dividing amount, that is milligram per minute, upon the plasma concentration, that is milligram per ml. If you divide this, what will happen? Milligram per minute multiplied by, okay, so what will happen? Ultimately you are going to get, okay, a unit which is ml, okay, per minute. What is this unit? ml per minute. What is this unit? This is a unit of volume per unit time. So if you divide this urinary amount upon your plasma concentration, you are going to get a volume per unit time. And what volume you are getting? It is that volume from where the amount of creatinine has reached in the urine. Getting my point? So if you just divide this amount of creatinine which is present in the urine upon your plasma concentration of creatinine, you are going to get a volume per unit time. What volume? The volume from where this amount of creatinine has been reached, that is the volume from filtration, that is the volume from secretion. This way, we are calculating the volume which is getting clear up. Okay, not by direct way, by indirect way, by dividing the urinary amount upon your plasma concentration. And if you divide the amount upon concentration, you are getting a volume. What volume? The volume from where the creatinine is reaching in the urine. And by definition, it is the volume of plasma which is getting cleared in unit time through a single circulation at the level of kidney. Getting my point? So that's why I told you that if you look at the definition of creatinine, it is the volume of plasma which is getting cleared in unit time. That is the clearance. Okay, so it is a volume, but we are not measuring that volume directly. We are measuring the volume indirectly. I hope you got what is the meaning of clearance. Okay, so volume, okay, upon time, that is the clearance volume. Okay, now how to measure the urine amount? How will you measure creatinine amount in urine? Okay, so for that you require what is the urine volume, that is the what is the urine volume per unit time, that is what is the flow of urine, multiplied by what is the concentration of creatinine in urine. Getting my point? I am asking you, how can you measure the amount of creatinine in your urine? You collect the urine, 24-hour urine maybe, okay, you measure what is the total volume per unit time and you multiply that volume with concentration of creatinine in the urine. So that way you are going to get the amount of creatinine in urine, right? So this flow of urine or the volume per unit time, that is the flow, that is denoted by V and concentration is denoted by U. Getting my point? So urinary concentration of creatinine or any other substances, you can measure any other substances also, that is denoted by U, and urine volume or flow, volume per unit time, that is the flow, that is denoted by V, and plasma concentration that you have measured from this arterial plasma, that is denoted by P. That's why we say that if you look at the formula of clearance, that is C, it is equal to urinary amount upon your plasma concentration. Urinary amount I am getting multiplying this U, urinary concentration, multiplied by urine flow upon your P, that is the plasma concentration. What will be the unit of this urinary concentration? It is the milligram per ml. What is the unit of this V? It is the ml per, okay, I told you that is the flow basically, ml per minute, okay, and what is the unit of this P? P is milligram per ml. Okay, so as you can find out here, urinary concentration as well as the plasma concentration in the same unit, and V, that is the flow, ml per minute, unit time volume is the flow. So this way, if any question is given based on this formula, you have to first convert all these unit into same category, that is the milligram per ml and ml per minute, and then you put all this value into this formula. The formula is simple and all of you know, I am 100% sure you know the formula, that C is equal to UB by T. That is the formula of clearance. Now we have to go a little more understanding about this clearance concept. Okay, so again I am going to my original statement, that is clearance is equal to urine amount of substances, okay, upon your plasma concentration of the same substances. Okay, we have taken the example of creatinine. It may be any substances. What you have to do, if you want to measure the clearance, you have to measure the urinary amount and plasma concentration. Now I am asking a different question to myself, that what is the source of any substances in the urine? Where from the substances is reaching in your urine? Okay, it may reach from filtration, may nahi, it should reach from by the process of filtration, right? Not only filtration, there are certain substances which also secreted at the level of nephron. So if there is secretion also, okay, then also the urinary amount will be increased. But if there is reabsorption, then urinary amount will be decreased. So I have to subtract the absorption amount from here. So now I can understand that urinary amount is equal to three basic process: filtration, secretion, absorption. I'm not saying that all substances will get filtered, secreted, everything. Okay, different substances have different properties, but ultimately my concept is that urinary amount is from three basic process: filtration plus secretion minus absorption, okay, upon your plasma concentration. So this is basically my clearance concept. Now suppose I want to measure the clearance of one substance which is not produced endogenously by our body. Okay, one such freely filterable substance is inulin, right? Okay, so I want to measure the clearance of inulin. Okay, why inulin? Okay, you know that this is the substances which is not going to be secreted or reabsorbed by the nephron, and it is freely filterable substances. So that's why I'm using this inulin for measurement of clearance, right? But it is not produced endogenously. So what you have to do, you have to first give an injection of inulin to the subject or to the patient. Okay, you are giving injection, certain amount of inulin you are injected in the vein. Then that inulin will be circulated through your circulation, and then it will reach at the level of your glomerular capillary. Okay, and then there will be filtration, then no absorption, no secretion. Okay, so I'm writing here because you must have to remember that no secretion and no absorption. Okay, obviously there will be filtration because it's a freely filterable substances. So now if I apply my concept of clearance in case of inulin, so C, that is a clearance of inulin. Clearance of inulin is equal to, I told you what is the formula. Formula is urinary amount upon your plasma concentration. Just now we have understood that urinary amount is by 3 basic process, but within those 3 basic process, which process is going to happen in case of inulin? Filtration, secretion, absorption, all. Only and only filtration, because there is no secretion, there is no absorption. So now I can understand that if you measure the clearance of inulin, the urinary amount is only and only due to the process of filtration. Okay, so whatever amount of inulin is getting filtered at the level of glomerular capillary, that is the amount of inulin which is going to reach at the level of your urine. Okay, so filtration amount, okay, I'm writing here filtration amount upon your plasma concentration. Right, now filtration amount upon your plasma concentration, I already told you, if you divide the amount upon concentration, what you are going to get? You are going to get a volume per unit time. So now I'm getting a volume. Okay, which volume? The volume from where the inulin is reaching in your urine. Getting my point? I told you that this is the volume of clearance volume. What is the concept of clearance volume? Clearance volume means that volume from where the inulin is reaching at the level of your urine. So I'm going to get a volume. Which volume? The filtration volume, because inulin has reached by only and only process of filtration. So the volume which you are going to get here is the filtration volume per unit time. Filtration volume per unit time at the level of glomerular capillary. What is the name of that filtration? This filtration is nothing but glomerular filtration rate, unit time. So that's why we say that if you measure the clearance of inulin, you are dividing urinary amount upon plasma concentration. Urinary amount is only and only by the process of filtration. So basically you are dividing filtration amount upon your plasma concentration. If you divide this, then you are going to get a filtration volume per unit time. Filtration volume per unit time at the level of glomerular capillary is nothing but GFR, and that's why we say that if you measure the clearance of inulin, you are going to get the GFR. And what is the normal GFR? That is 125 ml per minute. That's why clearance of inulin, if I ask you what is the clearance of inulin, you will say clearance of inulin is 125 ml per minute. What is that? It's a volume. What volume? The volume which is getting filtered, the volume from where the inulin is reaching at the level of urine. So you are giving injection of inulin and then you are measuring the urine. Okay, you are collecting the urine and you are measuring what is the amount of inulin at the level of your urine, and then you take a plasma sample, arterial blood sample, and you divide this plasma concentration, urinary concentration upon your plasma concentration. You are going to get the exact glomerular filtration rate. Please remember that it is said that clearance of inulin is equal to GFR, and it is the gold standard method for measuring the GFR, best method for measurement of the GFR. But nowadays, rather than using this inulin, we are using various other substances. You can also use various other substances which are similar property like that of the inulin. Okay, and what are those substances? Okay, chromium 51 tagged with EDTA. This can also be used for measurement of GFR. Okay, it is similar property like that of inulin, no secretion, no absorption. Okay, and it is a freely filterable substances. Not only that, iodine 125 tagged with iothalamate. Okay, iothalamate. This can also be used for measurement of the GFR. Not only that, technetium. Okay, TC99. You must have heard this name. Okay, DTPA. Okay, diethylene triamine. Okay, pentaacetic acid, that is the DTP. So all these three substances has similar kind of property like that of the inulin. That's why nowadays, rather than using inulin clearance, we are measuring the clearance of this DTPA, and that will give you the best measurement of the GFR, right? So the GFR is equal to clearance of inulin or clearance of EDTA, clearance of DTPA. This way the GFR is measured. Okay. Now, what is the property of all this inulin, EDTA or DTPA? They are freely filterable substances, but no secretion, no absorption. Okay, so now I am measuring the clearance of a substances, which is secreted at the level of nephron. Okay, so such substances we have already discussed. Example of such substances is creatinine. Not only that, para-aminohippuric acid. These are the substances which are secreted at the level of nephron. Potassium is also secreted depending on your potassium state in the body. So, if I measure the clearance of a substances which is getting secreted at the level of nephron, then what will be my concept? My concept will be like this. Clearance is equal to the same basic formula, amount in the urine upon your plasma concentration. Now, in these cases, because the substances is secreted in the nephron along with filtration, so the urinary amount is the combination of two basic process, that is filtration amount also as well as the secretory amount also. Getting my point? Upon your plasma concentration. So previously I have seen in case of inulin, this C I was calculating only taking help of filtration amount, but here filtration amount as well as secretory amount. So what is happening? The numerator is more in these cases. If your numerator is more, what will happen to your clearance? Clearance will be more. So if I ask you, when the substances is secreted at the level of nephron, the clearance of these substances will be greater than or equal to clearance of inulin or GFR. Obviously, it will be greater than GFR or it will be greater than clearance of inulin. Getting my point? So, if a substance is secreted in the nephron, clearance of that substances will be greater than GFR, provided later on it is not reabsorbed. That obviously you have to remember. Okay. So, this is the clearance greater than GFR if the substances is secreted. And the same concept, okay, very easy. Clearance of a substances which is reabsorbed. Okay. Reabsorption occurs at the level of nephron. If you measure the clearance of these substances, then the formula will be like this. C is equal to the same thing, that is the filtration will be there minus absorption or reabsorption. So after filtration, certain amount of substances is getting reabsorbed upon your plasma concentration. So obviously the clearance will be low clearance. So in these cases, if I measure the clearance of the substances which is getting reabsorbed and clearance of inulin, obviously the clearance of these substances will be lesser than that of the GFR, lesser than that of the inulin clearance, right? Okay. What is the example of this kind of substances? The examples are many. The examples of this kind of substances is like sodium. Okay. 99% of sodium is getting reabsorbed at the level of nephron. So obviously the clearance will be less. Urea getting reabsorbed at the level of nephron. The clearance will be less. Approximately 50% of the urea is getting reabsorbed at the level of nephron. And glucose. Okay. Calculate the clearance of glucose in a non-diabetic person. So whenever I'm calculating the clearance of glucose in a non-diabetic person, what is the formula? Formula is urinary amount upon your plasma concentration. What is the amount of glucose in the urine in case of non-diabetic person? 0. No glucose. So 0 upon P is equal to 0. That's why we say that the clearance of glucose in a non-diabetic person is equal to 0. Okay. So clearance of glucose is equal to 0. This does not mean that there is no filtration of glucose. There is filtration, but after filtration, 100% of glucose is getting reabsorbed at the level of proximal tubular epithelium cell. The same way, the amino acid also gets 100% reabsorbed at the level of proximal convoluted tubule. So that's why the clearance of glucose, the clearance of amino acid, they're absolutely 0 in case of non-diabetic person, in case of normal person. Right? So this way you have to remember that if there is secretion, the clearance will be more. If there is reabsorption, the clearance will be lesser than GFR. Okay. So now if I put this clearance of inulin at the center, clearance of inulin at the center, that is equal to GFR. What is that? That is 125 ml per minute. Okay. So clearance is more than this. What are the substances you know? You know that clearance of creatinine is more than this, and clearance of pH is even more than that. Okay, pH. I'll tell you the reason. Para-aminohippuric acid. So clearance of pH is the maximum, followed by clearance of creatinine, followed by clearance of inulin, which is equal to GFR, right? So obviously this is equal to GFR. Now clearance is lesser than this. What are those substances you know so far? Clearance of urea, 50% reabsorption. More the reabsorption, lesser will be the clearance. Then clearance of sodium, 99% reabsorption. Okay. And clearance of glucose, clearance of amino acid, 100% reabsorption. So this way you have to remember this sequence, that clearance of pH is greater than clearance of creatinine, that is greater than clearance of inulin, that is greater than clearance of urea, that is greater than sodium, that is greater than glucose. Now if I ask you, what is the position of potassium in these cases? Potassium, it can be present here between the urea and sodium, means clearance of potassium is greater than sodium but lesser than urea. So clearance of potassium can be here also, or clearance of potassium can be here also. Okay, means it is greater than creatinine clearance but lesser than pH clearance. When potassium is very highly secreted, okay, then this is the position. What is that condition? When your body has high amount of potassium, hyperkalemic state. Suppose you are taking huge amount of potassium in your diet. Suppose you are taking potassium containing tablets, then this is the scenario, okay, clearance of potassium. But normally body tries to conserve potassium, secretion is very less, okay. That's why the clearance of potassium will be in this condition when your body is depleted of potassium, low potassium in your blood, then this is the position. And when high potassium or hyperkalemic state, then this is the position of potassium in the clearance curve, right? So this way you have to remember the concept of clearance. So first step is done. Now I told you that clearance of pH, okay, is also important because the clearance of pH is very higher than any other substances. So why that is happening? We have to understand that also, okay. So to understand the clearance of pH, again I am drawing the same schematic diagram. You must be bored by the time, okay, that this is so boring, again and again the same diagram, but I cannot help, okay. So now pH, obviously you have to give injection into the blood because it is not endogenously produced. So you have given injection of PAH for measurement of clearance. There is a protocol, particular protocol, that how much amount of pH you have to inject, okay. So you have injected that much amount of pH. So pH will reach, okay, at the level of glomerular capillary, and it is homogeneously distributed, and is also a freely filtrable substances. So whenever I am saying it's a freely filtrable substances, I can easily understand that there will be filtration and certain volume of plasma will getting cleared at the level of this glomerular capillary, and the pH will reach at the level of Bowman's capsule. This is the same concept that we have discussed earlier, okay. So there is clearing of plasma here. How much percentage of plasma is getting clear at the level of filtration? That means I am asking how much percentage of filtration is occurring from the total volume, that is 16 to 20%, okay. And this is known as the filtration fraction. I hope you should remember that if you take GFR upon your renal plasma flow, this is known as the filtration fraction, and this filtration fraction I told you, this is 16 to 20%, and that is the meaning that how much portion of plasma is getting filtered, okay, that is 16 to 20%. So 20% of PAH is getting cleared up at the level of glomerular capillary. Remaining pH will move through this efferent arteriole, and then the pH will move through this peritubular capillary. Now PAH, there will be secretion, obviously. That's why the clearance of the pH is very high. So there must be secretion. Where secretion occurs? At the level of proximal convoluted tubules. How much portion? Remaining all the pH which is flowing through this peritubular capillary, all this pH will be secreted at the level of proximal convoluted tubule. So there is secretion, there is secretion of pH. Okay, how much portion? 80 percentage. Okay, that is the remaining portion of pH is getting secreted at the level of your PCT. So, how much volume of plasma is getting clear up at the level of peritubular capillary? 80%. So, 80% plasma is getting clear up at the level of your peritubular capillary. Okay, almost no remaining pH is there at the level of renal vein. So, no pH is going here. Okay, all are secreted at the level of PCT. So, 20% of the plasma is getting clear up at the level of glomerular capillary by the process of filtration. 80% of pH is getting clear up at the level of PCT by secretion. So, if I ask you, what is the volume of plasma which is getting clear, or what is the clearance of pH? Clearance of pH is nothing but it's a volume of plasma which is getting clear in 1 minute. In this cases, 20% is getting clear up by the process of filtration, and 80%, approximately 80% of the plasma is getting clear up by the process of secretion. So how much portion of the plasma is getting clear up? Almost 100% of the plasma, okay, is getting clear up whenever you are measuring the clearance of PAH. That's why we say that if you measure the clearance of PAH, you are going to get 100% of the plasma which is flowing through the kidney, and that 100% of plasma is nothing but renal plasma flow. That's why we say that clearance of pH is equal to renal plasma flow, and previously we have seen the clearance of inulin is equal to GFR. So please remember this, the clearance of inulin is equal to GFR because inulin is reaching at the level of urine only by the process of filtration, GFR. And clearance of pH, okay, it is from filtration, from secretion, 100% plasma is getting clear. Clearance of pH is equal to renal plasma flow. These two information you must have to remember. Now, clearance of pH is renal plasma flow. If you measure this, how much will be the number? How much will be the number? That will be 625 ml per minute. So, what is the clearance of pH if I ask you? 625 ml per minute. What is the clearance of inulin? 125 ml per minute. Okay, that's why I told you that clearance of pH is maximum among all other substances. Why? Because it is 100% of the plasma is getting clear. Can you clear more than 100% of the plasma? Answer is no. That's why the clearance of pH is maximum among all other substances. 100% of plasma. But again and again I am saying 100%. But is it 100%? Although I am saying 100%, but it is approximately 100%. Okay, because 100% of the plasma will not get clear even for the pH also, although for understanding purpose we have taken into consideration that 100%, but it is near equal to 100%. Actually this is 90%. Actually this is 90%. So that's why by the process of clearance of pH, the renal plasma flow that you have measured, this is known as effective renal plasma flow. This is known as effective, okay, effective renal plasma flow. This is not the actual one because actual is not 100%. Actual is 100%. Here it is only 90%. So if I want to calculate the actual renal plasma flow, then obviously this effective renal plasma flow divided by 0.9 because 90%. So if you divide this, okay, effective renal plasma flow is 625 ml per minute, okay, upon this 0.9. So this will be approximately 700 ml per minute. Getting my point? So this way renal plasma flow is calculated. Whatever you are measuring with the help of clearance of pH, that is effective. For actual conversion, divide that value with 0.9, right? So this way the renal plasma flow is measured. And if you want to measure the renal blood flow, we all know that from plasma flow, if you want to derive the blood flow, then it is nothing but, okay, your renal plasma flow upon your 1 minus hematocrit of the person, okay. So just put whatever renal plasma flow you have got upon your 1 minus hematocrit. So if your hematocrit is 45%, then you have to put here 0.45. Okay, so 1 minus 0.45 upon your renal plasma flow. Suppose the value has been given is 625. Then if you divide this, you are going to get the renal blood flow. So this way, clearance is used clinically for measurement of the GFR also, as well as for measurement of the renal plasma flow also. Now, whenever we are discussing this clearance of pH, okay, there is another problem. Another problem is that I told you that pH is not produced endogenously, so I have to give injection. And how much amount you are going to inject in the patient? There is a particular protocol. According to that protocol, you have to follow. But suppose you have injected a huge amount of pH into the patient by mistake. Okay, huge amount of pH you have injected. Okay. So what will happen? Obviously, the concentration in the plasma will be higher. Okay. So concentration of pH in the plasma is higher because you have injected huge amount of pH, right? So there will be more amount of filtration here. There will be more amount of clearance at the level of, okay, no problem in that. But the remaining volume of pH will go through this, proximal, peritubular capillary, and it will try to get secreted. In these cases, because the PAH concentration is very, very high at the level of peritubular capillary, do you think all this pH will be secreted at the level of proximal convoluted tubules when the concentration of pH is very, very high? Answer is no. Why no? Because the secretion of PAH at the level of proximal convoluted tubule is mediated by certain carrier protein, certain transporter protein. Okay, so certain transporter proteins are there. Now, whenever any secretion is mediated by carrier protein or transporter protein, it will follow a particular kinetics, and that kinetics is known as saturation kinetics. Saturation kinetics. What do you mean by that? Means, suppose there are 100 molecule of transporter here at the level of proximal convoluted tubules. If the pH number is 100 here, then all will be secreted. But if it is greater than 100, suppose 150, what will happen? All these transporter protein, all these carrier protein, they will be saturated, and the 50 molecule of pH, okay, will not be able to secrete it here. It will enter in the renal vein. That means I can understand that whenever the pH concentration is very, very high in the peritubular capillary, saturation is reaching up to a limit, and that limit is maximum. After that, further increment of secretion is not possible. That maximum limit is known as transport maximum of PAH. That is known as transport maximum, okay, of PAH. So transport maximum. Transport means it can be maximum absorption also, maximum secretion also. For pH, there is no absorption, but there is secretion. So I am trying to calculate that what is the maximum amount of pH that can be secreted at the level of proximal tubule by this transporter protein, by this carrier protein in 1 minute. In 1 minute. That number is known as transport maximum of pH. If you want to remember the value, I can give you, that is 80 milligram per minute. That means in 1 minute, 80 milligram of pH from the peritubular capillary can be secreted at the level of proximal convoluted tubule. But if the amount is more than that, then all the transporter protein, all the carrier protein will be saturated, and secretion will be reached to the maximum limit. No further increment of secretion is possible. So, when the PAH concentration is very, very high concentration of PAH at the level of plasma. In this condition, if you measure the clearance of PAH, so what will happen? The amount which you are going to measure at the level of urine, do you think that amount will be increased proportionally whenever you increase the pH concentration in the plasma? Answer is no. That amount will be reaching a maximum limit because secretion has been saturated. So this amount will be fixed. The amount will be constant. No further increment of pH secretion is possible whenever you have reached to this very high concentration. So the amount, okay, which you are measuring at the level of urine, that is constant, But because you are rising more and more pH in your blood, so pH concentration in the arterial blood is rising. Getting my point? So whenever you are injecting huge amount of pH in the level of arterial blood, in the level of vein, the arterial blood pH is high. So your denominator is very high, your denominator is rising, but your numerator, that is urinary amount, is becoming fixed, is constant. So in these cases, what will happen to this ratio? This ratio is clearance. Okay, your denominator is rising more and more, your numerator is fixed. So what will happen? The ratio will decrease. That's why we say that whenever the concentration of the pH is very high at the level of plasma, what will happen? The clearance of PAH will be low. Getting my point? Getting my point? So this concept is very important. Why? Because whenever you are measuring clearance of pH, why you are measuring? Because you want to assess what is the renal plasma flow. So you are measuring the clearance of pH, but suppose by mistake you have given huge amount of pH injection. That will cause a problem, because huge amount of pH means you are going to get a low value of clearance. Low value of clearance means your renal plasma flow may be high, but you are getting low value. You are getting low value because by mistake you have injected huge amount of pH. So what kind of low value you are getting? This is nothing but falsely low renal plasma flow you are getting in these cases, right? So this concept is beautifully described with the help of a graph. That graph I am going to plot here, okay? With that curve you will understand this better, okay? So this is a curve. In this curve, in the x-axis I am calculating the concentration of pH, and in y-axis I am calculating the clearance of pH, okay? So whenever the concentration of pH in the plasma is low concentration means up to 10 milligram per dl. If your pH concentration in the plasma is below 10 milligram per dl, okay, so you have injected little amount of pH according to the protocol, your plasma concentration of pH is lesser than 10 milligram of dl. In these cases, if you measure the clearance of pH, that will be equal to 625 ml per minute. What is that? This is the exact renal plasma flow, effective renal plasma flow that you are measuring, right? So this 625 ml clearance will be present up to this 10 milligram per dl concentration. If your pH concentration is more than this, suppose you have injected huge amount of pH by mistake and your pH concentration is rising more and more, what will happen to the clearance of pH? The clearance of pH will decrease, and then it will be stabilized like that of inulin. Okay, I will tell you what is this flat portion. But this flat portion indicates that this is the condition where secretion is almost stopped. It is only coming from, the urinary amount is only coming from filtration. Okay, that is similar to like that of inulin. Inulin has only filtration. So whenever it become like that of inulin, then the curve will become flat. But look at, so this point is the T max point, transport maximum point of pH. What is the meaning of that? Means at this condition, there will be saturation of all the carrier protein, all the transporter protein which is secreting the pH at the level of PCT lumen. So whenever there is saturation of all the transporter, no further increment of secretion is possible, but your plasma concentration is rising. So your plasma concentration is rising, but increment of secretion is not possible. So what is going to happen to the clearance? The clearance is going to be reduced and then it will become flat. So this way, this curve is very important. Okay, if you inject huge amount of pH, whenever your pH concentration in the plasma is greater than 10 milligram per dl, in these cases, the clearance of PAH will give you a false low value of renal plasma flow. Okay, so if you want to measure the renal plasma flow by pH clearance, the concentration should be lesser than this 10 milligram per dl. Then and then only you are going to get this kind of curve, right? Okay. Now in this clearance curve, if I ask you how the clearance of inulin will look like, inulin. If I give huge amount of inulin injection, okay, what will happen? Inulin is a freely filtrable substances. More you inject, more will be the concentration, more will be the filtration. So in case of inulin, injection amount is not a problem, because in case of inulin, more you inject, more will be the concentration, so more will be the filtration, and proportionally more is the plasma concentration. So what will happen? The ratio will remain constant. So that way, the clearance curve of inulin is a flat line, is a simple straight line, okay, irrespective of the plasma concentration. Whenever your plasma concentration is rising, inulin clearance is not going to change. So this is clearance curve of inulin. Okay, so rather than C inulin, I should write this is the inulin curve, okay, because it is the curve of clearance only. So this is inulin, okay, and this is our pH. So if I ask you clearance of creatinine, where you want to put that curve? Clearance of creatinine, it is secreted. Secreted means the value will be more than inulin value. So the creatinine clearance curve will be just above the inulin clearance curve. So this is the creatinine clearance curve. If I ask you clearance curve of glucose, where it will be present? Clearance of glucose in non-diabetic person, how much I told you? 0, 0, 0. So up to a certain volume, up to a certain value of plasma glucose concentration, when it is non-diabetic, the clearance of glucose is 0. That's why it is in the same line with that of the x-axis. But if the person is diabetic person, in the diabetic person, if you measure the clearance of glucose, so clearance of glucose you are measuring in case of diabetic person. So there will be certain amount will be present in the urine and the plasma concentration. So in these cases, it is not 0, it is more than 0. So that's why more the plasma glucose concentration in diabetic person, more will be the clearance of glucose in diabetic person. So that way, in case of non-diabetic person, non-DM person, the clearance of glucose is 0. But in case of diabetic person, the clearance curve will be more and more rising towards the inulin curve. So this is the clearance curve of glucose, right? So this way, you have to remember all this curve, because image-based question has been given from this curve already in AIIMS and Central Institute examination. So this way, you have to remember the clearance curve of pH. Done? I hope you got it. Okay. So now, after discussion of this clearance of pH curve and all, now another concept we have to remember, that is the free water clearance. So whenever we say clearance, this concept you will also read in your pharmacology, clearance of various drugs. But whenever we say free water clearance, there is a little different concept, little different, right? So I'm writing here, free water clearance, which is also known as free water production. Free water, okay, which is also known as free water production. Okay, so free water clearance or free water production, generally it is denoted by C, that is the C, just hold on, CH2O. Clearance of water, free water clearance is denoted by CH2, clearance of water, free water clearance. Okay, what is this concept related to? The concept is related to urine concentrating ability. So if I ask you, tell me the clearance of water, free water clearance concept is related to, this is related to urine concentrating ability. Urine concentrating ability of kidney. This is denoted by CH2O, free water clearance, right? Now to understand this concept, first you take one example, okay? So constantly we are producing various waste product in our body which has to be excreted by the kidney, and kidney is there to excrete those waste product from our body, right? So in a 70 kg adult, normally, okay, in normal cases, 70 kg body weight adult person generally produces 600 milliosmoles solutes which has to be excreted by kidney, because these are the waste product. And what are those inside this 600 milliosmole waste product? Urea will be there, okay, obviously your creatinine will be there, and other salts will also be there, which has to be excreted by kidney. 600 milliosmole per day, this much amount of osmoles has to be excreted by kidney. Now suppose to excrete this, you require to excrete water also, because this substances has to be filtered and then it has to be excreted by the urine. So you have to excrete the water also. Suppose the total volume of urine, okay, or the total volume of water is 2 liter. Okay, so you are excreting 2 liter urine to excrete this amount of solute from the body. 2 liter urine, 2 liter water you are taking to excrete the 600 milliosmoles substances from the body. So if I ask you, in these cases, what is the osmolality of urine? Simple question. 600 milliosmoles is present in 2 liter of urine. So what is the osmolality of urine? So in these cases, the osmolality of urine is 300, okay, milliosmol per liter or per, okay, per liter. So this is the osmolality of urine in these cases. What is the normal plasma osmolality? Normal plasma osmolality is approximately 300 milliosmol per liter. Okay, actually that is 285 to 290, but approximately that is 300 milliosmol per liter. So in these cases, I can understand that for excretion of 600 milliosmol solute from the body, whenever you are excreting 2 liter of urine, the urine is isotonic to plasma. So I can write down here like this, that in these cases, the urine is isotonic to plasma. Isotonic to plasma. So whenever urine is isotonic to plasma, urine osmolality is same to same with that of the plasma. Do you think that urine is excreting extra water for excretion of the waste product from the body? Do you think the urine is excreting less water from your body for excretion of the waste product from the body? Answer is no, no, no. Neither it is excreting extra water in the urine, neither it is excreting less water in the urine, because the osmolality of the urine is equal to the osmolality of the plasma. Okay, so this way, the urine is not excreting any free water in the urine. So, in these cases, the free water clearance, that is CH2O, is 0. Okay, getting my point? No extra water, no free water in the urine for the excretion of the waste product from the body. Urine is isotonic to plasma, that's why no extra water, so free water clearance is 0. Simple from this concept, whenever I will say that urine is hypotonic, urine hypotonic, mean tonicity of the urine is lesser than plasma osmolality. Urine is diluted, that means I can understand diluted urine. Whenever the person is excreting diluted urine, then the water content in the urine is extra. So urine is excreting, okay, extra water, which is not required. It can excrete in isotonic state also. But here, urine is hypotonic, means dilute urine is produced by the body. So from the body, there is extra loss of water in the urine. Urine is excreting extra water. So free water is present in the urine. This is the condition when we say that free water clearance is positive. CH2O is positive. Okay, so free water clearance is positive in these cases. Urine is excreting extra water, free water. Okay, what is the clinical condition? Suppose the person is suffering from diabetes insipidus. Free water clearance is very, very high. Urine osmolality is very, very low. Urine is hypotonic. Okay, so urine hypotonic means the free water clearance is positive. And the opposite one, when the urine is hypertonic, urine is hypertonic with respect to plasma, that means concentrated urine is produced, means urine is not taking extra water, not even extra, it is not taking the adequate water also, it is conserving water in your body. Urine is taking less water. So in these cases, no free water, even lesser than free water, lesser free water which is required, is excreted in the urine. That's why we say that free water clearance in this condition is negative. This is negative clearance, called free water clearance. When it will happen? When your hormone, that is the ADH hormone level, is very, very high, because ADH reabsorbs a huge amount of water from the collecting duct. So that way, a clinical condition which is known as SIADH, syndrome of inappropriate antidiuretic hormone. SI, that is a syndrome of inappropriate ADH secretion. Huge amount of ADH is secreted by some ectopic tumors from the body, and that absorb huge amount of water from urine. Urine get concentrated, so free water clearance is negative. So this is the concept of free water clearance. But if you look at books, some of the books are giving you this free water clearance concept with the help of an equation. So we will also write down that equation. So free water clearance equation is written like this: CH2O is equal to V minus UV upon P. What is this V? I told you earlier at the concept of clearance, V is equal to urine flow. What is U? Urine is the urinary concentration. And what is P? P is the plasma concentration. So this is the formula, okay, which is written for calculation of the free water clearance, V minus UV by P. So if I simplify this formula, CH2O is equal to V 1 minus U upon P. Now look at this ratio of U upon P. When your urine is hypotonic urine means U is lesser than plasma concentration, so U upon P is less than 1. Whenever this U upon P is less than 1, what will happen to this free water clearance? Free water clearance will be positive, getting my point. So it will be 1 minus, which is lesser than 1. 1 minus something, maybe 0.8, maybe 0.7. So if you put into this formula, that 1 minus U upon P, that is lesser than 1, then free water clearance will be positive. Similarly, whenever your urine is hypertonic urine means U, that is the urinary concentration of solutes, is greater than P, so it will be more than, it will be more than 1. Whenever it is more than 1, I can easily understand that if it is more than 1, so the whole ratio, that is the CH2O, will be negative. So in these cases, the CH2O will be negative. So this way also, you can also remember the concept of free water clearance, that it is V minus UV by P, that is the free water clearance, right? So this is the concept of free water clearance that you have to remember. Now sometimes certain applied aspect can be given from this topic. Like for example, if you give furosemide diuretic, Lasix diuretics, furosemide diuretics, we know that these diuretics block the NKCC transporter at the level of TAL. So you must be thinking that sodium chloride potassium absorption will be inhibited because you are inhibiting this. So huge amount of solute will be excreted in the urine will be concentrated. No, it will also inhibit the reabsorption of water. So furosemide means same amount of salt will be excreted in the urine, same amount of water will also be excreted in the urine. Urine will remain same to same tonicity. That means in case of furosemide therapy, if I ask you CH2O, that is the free water clearance, what will happen to that? It will remain same to same, that is 0. It will remain 0, right? In case of thiazide diuretic therapy, two conditions. If you are giving thiazide to a patient who has already a positive free water clearance, already the person has a positive free water clearance. In this patient, you are giving thiazide diuretics. Already he is excreting huge amount of water freely in the urine. In this person, if you give thiazide, then there will be reduction, then there will be decrease in free water clearance. In this case, thiazide will causes decrease in CH2O in this patient. But if already CH2O is negative, negative free water clearance, then there will be no effect of thiazide diuretic therapy in this patient. Getting my point? So whenever you are giving thiazide diuretics to a patient who is excreting huge amount of free water clearance, positive free water clearance, it will reduce that. Thiazide will decrease it. But if the free water clearance is already negative, then thiazide diuretics has no effect, and furosemide diuretics has also no effect. The free water clearance will remain 0 in case of furosemide diuretics therapy. So this is all about the concept of your clearance and free water clearance.